Hi, everyone. Welcome to CareAcademy's COVID-19 Weekly Roundtable. I'm Helen Adeosun, CEO and co-founder of CareAcademy, and I'm joined by some very great guests this week, including Dr. Madhuri Reddy to give our healthcare update. We'll give folks a couple minutes to get in. Happy Friday. Hopefully things have just mellowed out this week. But we're definitely here to answer your questions and really excited for the topic of today's webinars as well. So just grab your favorite cup of coffee, grab a tea, and we'll get started in just about a minute. Thanks so much. Yes, Howard, the audio is working. We're just going to give folks just 1 minute or so to make sure that they're in their seats and they're ready to go. I see, but Howard, welcome. Thanks so much. Awesome, awesome. So I see folks are joining. Again, welcome, happy Friday. You made it. Hopefully you have some plans to catch up on more Netflix, and we hope that you all are staying safe and that your businesses are safe, any of your employees are safe, and your clients are safe as well. So you are in the right place if you're here for the CareAcademy COVID-19 Weekly Roundtable, where we cover a host of just the most important points to you and to your staff as far as making it through COVID-19. But the idea here, folks, is that we're discussing things that are important to you and that we are a tool and a resource for you and your staff to make it through this, and we will make it through together. So before we get started, some housekeeping before I introduce our guest for this week's roundtable. If you haven't used Zoom webinars, welcome. It's a great tool. At the very bottom, you'll see that there's a control panel where you can chat. I see folks who are checking in. Wardain is checking in. Welcome, Wardain from Comfort Keepers. But that's a great way for you to talk to the panelists as well as just introduce yourself. Throughout this roundtable, it's meant for us to all interact together. So our panelists will give advice, and we'll definitely be calling on folks as well to offer us their feedback and their best practices as well. So if you click Q&A to ask questions. Our panelists on today's webinar can definitely see that, and we'll promote and answer as many of those as possible. And if we're going to ask your question live, we'll take you off of mute, and it'll look like those two images. So if you're tuning in today, we'd love to keep it interactive. We'd love to make sure that folks are able to provide in real-time feedback. So just get ready. If you ask a question, I'll let you know if we're asking it live. I'll also ask your question as well to make sure that if we have technical issues that your question gets answered live. And so just so you know who we are CareAcademy. I'm the CEO and co-founder. And we are the #1 company ensuring classes are completed. So we're here to meet your compliance needs for your staff as far as training. We have 160 hours of training that's available in our library. We're specifically designed for mobile, and so the idea here is accessibility. We want to make sure that your caregivers have access We have a dashboard for quick onboarding. So just keep in mind that, as your direct care workers are going through their training, you have access to that on your end. We have portable records, so direct care workers can submit and port over to your company their training records. And last but not least, we have customer support, not only for your staff, but also for your back office staff, but also for your direct care workers, as well as API integrations that are built in, meant for you to keep all your records all in one place and make it very easy for you to onboard your direct care workers and keep them in compliance. So as we have our panel, we always love for you all to keep engaging, keep interacting, make sure to submit your questions and responses below. Like we had last week, we also want to get to know you all. So we have a set of poll questions that we'd love for you to answer, just so we know who's in the audience today. But before we do that, I just wanted to share our bios. And so the first bio is of Dr. Madhuri Reddy, our Chief Medical Officer and the co-founder of CareAcademy. She's a specialist in internal medicine and geriatric medicine and holds appointments at Harvard Medical School and Hebrew SeniorLife. For years, she's seen firsthand the struggles that families and caregivers go through while caring for older adults, and Dr. Reddy's published several research papers in prestigious medical journals, book chapters, and also a book for families and caregivers, and has been a constant source of wonderful information and knowledge over the course of these last webinars. And so I want to thank her. I don't thank her often enough, but I'm really grateful to have her on our panel today. And then our panelist for today and a special guest is Doug Pace, NHA. So Doug is the Director of Mission Partnerships with the Alzheimer's Association. In this role, he provides strategic leadership in quality, person-centered dementia care in long-term and community-based care. Previously, Doug was the Executive Director of the Advancing Excellence in Long-Term Care Collaboration, and AELTCC's major initiative was the Advancing Excellence in America's Nursing Home campaign, a national campaign to improve the quality of life and quality of care for the country's nursing home residents. So really great information that you can provide today in terms of caring for dementia patients in all sorts of settings. And prior to AELTCC's, Doug was the Executive Director of the Long-Term Quality Care Alliance. Before joining LTQA, Doug was the Director of the Long-Term Care Solution Campaign at Leading Age in Washington, D.C. So really glad to have you on today, Doug. And then next, we also have Steve Smith from the National Program Director for the Home Health Care and Hospice, and works with the Cincinnati insurance companies. Steve Smith serves as the National Program Director of the Home Health Care and Hospice Commercial Insurance Programs at Cincinnati Insurance Companies. Steve has been in the insurance industry for over 20 years and holds chartered property casualty underwriter and associate in the management designations. And Steve, I'm not going to read everything here just because I want to make sure people get into the questions for today. But Steve is also a licensed insurance agent, and his expertise includes commercial auto, property, general liability, professional liability, and crime. So a really great set of panelists for you all today. I'm very excited. So let's go ahead and find out, now that we know about our panelists, let's find out more about you all in the audience today. So quick poll question. What is your biggest concern and need right now? So we have just two questions actually. How many employees do you have at your agency? And what is your biggest concern right now? So that's multiple choice. You can answer with multiple responses. So if you just take a second to respond to those, and we'll keep that up for just a second and then look at the results of that. But let us know how many employees you have at your agency, and then also what is your biggest concern right now. All right, so while folks are finishing that up, I'm going to have Madhuri give us an update of some of the best guidelines, and then right after that update, we will make sure we have the responses to that poll. But Madhuri, thank you so much again for joining us this week, and let us know what are some of the best updates and guidelines that you suggest this week.
Thank you, Helen. So as everybody knows, there's been a lot changing over the last few weeks with respect to the CDC guidelines along PPE and when people can go back to work. And actually, what's been a change in the last week or two is there haven't been as many changes. So I'll just reiterate what the CDC guidelines are for PPE. The other thing I'd like to mention, because we got asked a lot about this too, is testing. So there isn't yet a serology or blood test available to test if somebody has or has had COVID-19. And as a result of that too, we don't know if once someone has had COVID-19, if they're immune to it or not. The thought is by most experts that they probably can't get COVID-19 again, but that is not known for sure. The other last thing I'll mention before just reviewing the PPE stuff is vaccine. So there's a lot of talk of how long it will take to get a vaccine. And again, it probably, people have a wide range of estimates for it, but it may not take, it may take 18 months or so to get one. So let me review the PPE information, and I will share with you a few specific links to the CDC site about where you can get more detailed information and more up-to-date information. I believe that the PPE information was last updated, I believe it was April 13th. So as everybody knows, it's a time of transition because of the relative shortage of PPEs, but this has actually been starting to look a bit brighter as well, as more private companies have been developing PPEs. And I believe the Home Care Association of America, if you go on their site, they have some links as to where you can procure some PPEs. So in a situation where there are plenty of N95 masks and gowns and gloves and everything else available, if we were all seeing patients or home care workers, home health workers are seeing people with COVID-19, they would be instructed to wear an N95 mask and gown and gloves and change between patients and change yourself after you've seen each patient, but that is not the situation now. So if you look on the CDC site about PPE, which I'll share with you shortly, they have 3 situations, and they suggest that you amend how to wear PPE depending on what the situation is. So if there are plenty of face masks, but not enough N95 respirators, direct care workers would not need to wear N95 masks unless they're taking care of patients during aerosolizing procedures such as vent or nebulizers. The second situation is no N95 masks and limited surgical masks, which is the situation in most cases, it seems, no N95 masks and limited surgical masks. And your agency doesn't have access to N95. The CDC recommends extended use of face masks or surgical masks. So the direct care worker may need to use the same face mask when caring for different recipients, removing it after each encounter. And face masks with elastic ear hooks are easier to remove than those with ties at the back. And between uses, this mask should be folded neatly, don't touch the inside, and placed in a breathable container such as a paper bag. It's recommended by the CDC that face masks are prioritized for conditions where splashes and sprays are expected, and the direct care worker should stay 6 feet away from the client except when absolutely necessary. Any clients with COVID-19 should be wearing the mask at all times if they're able to. In the third situation where there's no N95 masks or surgical masks available, and this is absolutely the last case scenario is the recommendation for homemade masks, but that does not appear to be something that you'll need to do at this time, because at least surgical masks are available. The homemade mask situation, I mean, there's no evidence that those masks protect the wearer. And if anything, they help spread the disease, help prevent spread of the disease to others. And that's why the recommendations from the CDC are for the general public to wear masks to help contain the spread and not protect the wearer. So Helen, I think I'm going to stop there kind of as an introduction and let the other panelists go. And of course, I'll answer any specific questions as we move through this. I can't hear anything.
Yeah, Helen, we can't hear you.
I was on mute. Thank you so much for that. I was doing a very nice pantomime for you all, but just quickly to summarize. So Tim Cook said, great information. Yes, this will be available as a handout. And just to if anything, circle up on what Madhuri just said before we share out the polling results. So Deborah Weaver asked, how does the nurse determine client expectations for wearing masks and or gloves during a meeting, and how to care for dementia patients if one has to wear PPE? Doug, I know you definitely may have some insights on this, but Madhuri, do you have any thoughts initially on Deborah's question?
First of all, it's a great question. I think the whole issue of dementia, patients with dementia having to deal with the social isolation and not being able to read facial cues and expressions is an extremely challenging one. So client expectations for wearing masks or gloves during a meeting, I mean, all you can do is really point to the CDC guidelines, since they're the ones who are deciding this, and for you all to abide by what those guidelines are and point to them as a reason for why you're doing this. And as we said a few other times, is in the situation where there's not always specific guidelines, to absolutely just do the best you can and document why you're doing that. And in terms of caring for dementia patients, one idea that I have heard that people have been doing is taking a photo of themselves and putting a badge on their lapel or something, so at least the person might be able to tell what you look like. But I'm sure Doug has some other ideas about that too.
Yeah, absolutely. Thank you so much, Madhuri. And Doug, if do you have any initial responses, or we can just even maybe you'll address that in your presentation.
Yeah, well, I'll just wait till it's my turn.
Perfect. Awesome. So let's go ahead and get into our poll results. So how many employees do you have at your agency? It looks like everyone sort of trends pretty equally across the board. So we've got 23% of you all have 0 to 25, 26 to 50, that's around 21% of those folks tuning in today, 29% of 51 to 100, and 24% of 100, and 1 to 500, and 5% of you who have 501 plus direct care workers. And it also looks like the biggest concerns that you all are having right now are clients that are canceling care who are potentially ill or concerns about becoming ill who have COVID. So that's really helpful for us. That's a little over half of you have that as a general and ongoing concern. And then also just in a distant second, but still pressing, is not having enough PPE. I think we're hearing a lot of that over the course of the last weeks. And sourcing PPE, we'll see if we can provide you all with some links to organizations or companies that have been vetted in terms of providing PPE. And in these last couple of weeks, we've seen organizations like the Home Care Association of America in terms of helping home care agencies source the best places and vetted organizations for PPE. And then a couple other folks said, and these seem very close, caregivers not being able to work, so folks not showing up or out sick, proper care instructions for treating COVID-19 positive clients and patients, and not having enough caregivers to staff current needs. We do a round of customer calls on a weekly basis, and this is actually something that's now emerging more than ever, is not having enough caregivers to work. So this is really helpful, and thank you so much for answering this poll. And so we have other questions that are popping up. I see them showing up in our chat. Thank you so much. If you want to copy paste some of those and put them in Q&A, in that Q&A section, we can make sure we queue those up for our panelists, and then I'll take a look at some of the ones that people have already asked as well. So keep asking your questions, put them in the Q&A, and we'll make sure we key those up. But without further ado, I'm going to go ahead and transition over to Doug, who is going to give us just a set of best practices in this very specific moment. And Doug, we'd love for you to go over your presentation, and then what we'll do afterwards is forward maybe some of the questions that come up as a result of your presentation as well. But without further ado, Doug, take it away.
Thanks, Helen. Thanks so much for inviting me to be part of the conversation today. And as Helen said, I'm going to be talking about emergency preparedness and some guidelines the Alzheimer's Association recently developed. And these guidelines are for all paid healthcare professionals across long-term and home and community-based care. And on this first slide, it shows you a link. So you're going to see a lot of slides today that have a lot of dense information on there. Don't worry about trying to absorb all of that, because if you go to our website, you can download everything that I'm talking about today around these emergency guidelines through that link, and then I'll be sharing some other links as well. So we can go to the next slide. One thing I wanted to sort of start with is every year we publish our facts and figures report. And, you know, this is a report that's really used widely by many different audiences to really understand where we are today with Alzheimer's and all dementia in the United States. So next slide. And what that report tells us is there's currently more than 5 million Americans age 65 plus living with Alzheimer's. And we know that that number could triple by 2050. It's now the 6th leading cause of death, and it's now the 5th leading cause of death for those age 65 and older. One of the things that we do every year is have a special report as part of our facts and figures report. And this year it's focused on the role of physicians. And as you can see, there is a concern around the physician community saying that they're really not prepared to meet this demand. The next slide. And this just gives you, and again, if you go to our facts and figures report, this report is downloadable for free off of our website. So if you go to alz.org/facts and figures, it'll take you directly to all of this report. But this just gives you a snapshot of a little bit of forecasting, looking at state by state with people with dementia by 2025 and where we expect to see some of the greatest areas of increase. Next slide. And we also know that these new findings reveal the growing toll of Alzheimer's caregivers. In 2019, more than 16 million Americans provided an estimated 18.6 billion hours of unpaid care, valued at $244 billion. And you know, think about that for a minute. We know on the paid side of care, the side that you guys work on, it's about $290 billion a year. So already today in 2020, you know, we are past that $500 billion mark. But think about the unpaid care that's being delivered, and this is care before they maybe are reaching out to you as a home care provider to really need some of that additional help. Next slide. And I think this slide is just important because it really talks about who are those caregivers. We know that half of them are caring for their own parents. About a quarter of them are those sandwich generations who are not only taking care of their parents, but they also have their children living at home. And that just, you know, provides an extra level of intensity with those caregivers. And about 2/3 of them are women, and about 1 in 3 are age 65 or older. And I think it's also really important to notice that 41% of caregivers have a household income of $50,000 or yet less, and about 66% of those live with a care recipient in their community. Next slide. So I'm going to pivot a little bit. The emergency preparedness guidelines that we've developed are built on the foundation of the dementia care practice recommendations that we released in 2018. I was the co-lead of developing those along with my colleague, Dr. Sam Fazio. And so we updated the recommendations that we'd had previously from about 10 years ago. These recommendations, we worked with 27 expert authors to write articles for the gerontologist. At the end of that, they developed 5 to 7 recommendations. We rolled all of those recommendations up, and those are become the Alzheimer's Association Dementia Care Practice recommendations. And for us in association, they really do represent that foundation for how we believe quality dementia care should be delivered. Next slide. And just to let you know the topic areas of those, one of the things, as someone who's worked in culture change in the person-centered care movement for 20 plus years, I'm really thrilled that the association sort of put our stake in the ground to say, good dementia care has got to flow through a person-centered focus. And I'll talk a little bit about that more later. And again, if you go to alz.org/quality care, that will take you to the full report. You can download the full gerontologist report, or you can download different topic areas as well. But this just gives you the area of focus around our dementia care practice recommendations around the 10 areas. Next slide. So as we decided to develop these guidelines, we did it because we know that during this time, there may be non-clinical staff, or there may be people from other departments or new healthcare settings that are going to have to work on delivering care in all settings, whether that's nursing homes, assisted living, or all of the home and community-based services. And we also know, based on our facts and figures report, that a high level of everyone that's being served in these settings have some form of dementia. So in nursing homes, it's around 48%. In assisted living, it's around 42%. In home health, 32%, and 31% in adult day services. And again, I think those numbers are probably low. This is based on the best evidence that we have, but more than likely, the number of residents that folks are serving in these settings is even higher than these numbers. Next slide. So the first part of these guidelines, and you'll see when you download those from our website, really talks about the best ways that the paid healthcare professionals can work on preventing illness. And a lot of this is what you're hearing, and I just want to reiterate what Madhuri said, is really CDC is your resource right now. We know that information is changing quickly, and anytime that you are trying to get your best source of information, we really believe that that CDC website is the best place to do that. But we really did want to start with hand washing. Just remind folks that that is the best way to prevent the spread of this illness and the best way to break the chain. Several years ago, I was fortunate enough to travel around the country and work on an infection control workshop in nursing homes. And, one of the things that we discovered in that environment is, the staff was pretty good about having protocols around hand washing. But one of the things that we realized, and sort of was an aha moment for a lot of these providers, was they didn't have a good regimen with their residents around hand washing. So, this is a good time as you're going into clients' home, just reminding them, and it may be harder to have a hand washing schedule when you're going into someone's home, but just thinking about talking to them about that. And then also remembering that the use of a moisturizer is really important during this time as well, because those sanitizers and those soaps are harsh, and you really have to worry about skin integrity. And so making sure that you're reminding folks to use those moisturizers well is really important. And then the other one, of course, we put in there about adopting social distances practice and refraining from sharing items. And, we know that this is a huge issue with dementia patients and dementia residents and dementia folks with dementia that are living in home care settings. And just want to be, stress the importance of doing that, but also, being realistic and mindful that, we know that, for instance, some folks with dementia are huggers, right? And so it's hard for them who are used to having a hug to not be able to do that anymore. So that's just layers that I think the complexity that we acknowledge and realize that all of you working with patients with dementia have to deal with. Next slide. And again, the reason that we developed this is because we know there's going to be staff that may not be grounded in those person-centered care principles. A lot of you who are used to dealing and going into homes or working in a community-based setting, you're trained in what good dementia care looks like. But we wanted to be able to have these guidelines built off of our dementia care practice recommendations to really have a quick resource for someone who may not be grounded in those person-centered care activities. And we know people with dementia, and again, you know all of this, they may become more confused, frustrated, or even display an increase in dementia-related behaviors during the crisis. They're less often to adapt to changes to their environment, and they really thrive better in an atmosphere that minimizes any changes in routine to their environment or their daily structure. And we know during this COVID experience that that's harder to do. Next slide. So, as I said with our dementia care practice recommendation, it starts with knowing the person. And if you think about our 56 dementia care practice recommendations, recommendation number one is know the person. We truly believe if you're going to provide good quality dementia care, then you've really got to know the person who you're taking care of. And once you know that person, then you recognize and accept their reality. And then you identify and support ongoing opportunities for meaningful engagement. And when you do that, then that builds and nurtures those authentic relationships. And then it creates and maintains a supportive community for not only the persons with the dementia receiving care, but also for families and also for staff. And I think we've got to remember too how important it is for when staff feels like that they are knowledgeable and prepared, it allows them to do a better job and to feel better about the job that they're doing. And then evaluate care practices regularly and make appropriate changes. You know, and I know in the home care world that this is something that, you know, is not as embedded as it is in other areas. And, you know, now's not the time to really focus on that. But I do think it's important to remember that it's really important to have some sort of quality improvement program, because you really don't know if you're making a difference in care unless you're measuring it, see where you need to make changes, and then use those tools and resources to improve your delivery of care. The other thing I just want to mention is we did call out advanced planning under these tips, because this is the time it's even more and more important. And why is that important? It's really important that you connect with the folks you're taking care of to make sure that their wishes are honored. You know, in the case of an emergency or in the case of a transition, that's not the time for folks to be filling out what their end of life wishes are. Now's the time for be thinking about that. So if they're in an emergency situation, that's something that's already been taken care of. Next slide. One of the things that we talk about in these guidelines is having some sort of a personal information form. So again, if you're having someone that is having to work with a client, and again, maybe they're from a different setting, or they're coming in and they haven't dealt in dealing with a person with dementia or that particular person before, how could you develop a form that either you could have that you have in the resident's home, or something that you have in the packet of information that's going into the homes of folks that just has some quick information? You know, what do they like to be called? You know, what upsets them? What calms them down? You know, what is their normal structure? What are their normal eating and drinking patterns or activities? What are their religious or spiritual practice? And, you know, what are their remaining abilities in their motor skills and their communication and abilities and methods? You know, it's just, and again, this is not an exhaustive list. These are just some ideas of some types of forms that you could develop so someone could get a quick snapshot of that person if they haven't been serving that client before. Next slide. And then the next piece we talk about, and again, you know, remembering that these guidelines are developed for facility-based settings and non-facility-based settings. And I should have said earlier, you know, one of the things we were really excited about, we developed these guidelines pretty quickly. And then we reached out to a lot of organizations and associations to collaborate with us on that. And if you, and you will see, we had 36 organizations and affiliated associations, including the Home Care Association of America, that signed on to these guidelines to help us in the dissemination. But, you know, one of the things that's important is helping keeping families and friends connected. And, you know, we are seeing right now in nursing homes and assisted living that the social isolation piece is really becoming a huge issue. But that's also got to be true for people living at home. If they're living at home alone, that social isolation piece is really crucial. So how can you help with that? One of the ways is, and I'll talk a little bit more around video technology and how you can maybe help them connect with some friends and family outside of their home. But again, maybe it's developing that what you should need to know fact sheet. So making sure that everyone has all the information they need, how families contact you, how you contact family, but then also some other things like what adaptive devices do they wear? So again, thinking about an emergency situation where someone might have to go to a different healthcare setting. And if you're not familiar with that client, then having a form that says this person has dentures or they have a hearing aid or they wear eyeglasses, just having that information quickly available. And then just remembering that every family is unique. So sometimes it's a family member that is providing their support, but sometimes it's friends that are doing that as well. And just remember that there's no certain template for that. Next slide. And then this one is really important for folks with dementia, because we know many times folks with dementia may need assistance with eating and drinking, and that may involve verbal, visual, or tactile clues. And really staff should familiarize themselves as much as possible with the person's eating and drinking abilities. And we know that people with dementia most likely do need to be reminded, depending on what stage of the diseases they're in, to drink and to eat, and because they may not be able always to remember to recognize hunger or thirst. And sometimes just sitting or talking with a person at mealtime might improve intake. You know, one of the things that I do with the Alzheimer's Association is run a Project Echo series. And Project Echo is a video-based teleconferencing, case-based learning platform. And we're currently running one right now with some assisted living facilities in Minnesota. And one of the things that we've heard is, in that setting, is that residents are starting to eat less because they miss that communal dining experience. And if they're eating alone, they're not eating as much. And so I had one staff person that said, for a particular resident who was having a problem, she just literally just sits with that person while they eat their meal. And now he's finishing his meals completely where before he wasn't. Next slide. Monitoring walking and unsafe wandering. And again, sometimes this might be more appropriate to a residential or community-based setting. But again, I think it's important to remember walking is a purposeful motor activity. You know, I think a lot of us that have lived in the culture change world, we use the negative connotation of having wanderers. But, you know, walking about is a good thing. You know, it helps in the prevention of pressure ulcers. It helps in the prevention of people losing muscle strength. So just remembering that it's important that people still have that ability to get some exercise, to walk around. And if you're dealing with clients in the home, you know, if they have a backyard, going outside with them. You know, we know through evidence, for instance, with bright light therapy, and we have a dosage, a recommended dosage. You know, if someone can spend 20 minutes outside between 9 a.m. and noon in the morning, that's the recommended dosage for bright light therapy. So just remembering that not only do people need the ability to still walk around and walk about, but also to make sure that they are in a safe environment as well, because we want to make sure that they're not in an unsafe environment where they can cause harm to themselves. Next slide. The main part of these guidelines really talk about observing and responding to dementia-related behaviors, because we know behavior is a form of nonverbal communication for the person living with dementia. And many times that response is for them to communicate a feeling, an unmet need, or an intention. And we know many times that these can be triggered by an interaction between the individual and his social or physical environment, which again is so important as much as possible to provide that consistent routine. And then knowing that a response may include striking out or screaming or becoming very agitated or emotional. And so it's really the care provider's role to observe and to attempt to understand what the person living with dementia is trying to communicate. Next slide, please. So we just list a few ways. I mean, the first thing you need to do is to rule out what the root cause of that behavior may be. And here we just list a few of those. It may be pain, it may be hunger, it may be fear, it may be that overstimulation, or it may be them having this difficulty understanding or misinterpreting their environment. Or, you know, as was talked about earlier, it's that unfamiliarity with PPE and not being able to see the staff member's face. And I love the example of someone having a picture. I mean, one of the exciting things that we are seeing in all of the terribleness with this situation is the creativity of people to come up with ideas. And I think that's a great idea. The next slide, please. And again, I apologize for everything on here. And again, if you can download this quickly, but we just wanted to talk about some strategies to how you deal with these dementia-related behaviors. And really, the first one, to rule out pain, thirst, hunger, or the need to use the bathroom, is a good place to start, because we know many times that may be the issue that they're trying to express, and that can take part of it. Speaking in a calm, low pitch voice is always important, trying to reduce that excess stimulation, but also remember to validate the emotions of the individual. that sometimes recognize their emotion is more important than recognizing the words they say, and understanding that sometimes their thoughts and feelings are relative to their own reality and not to our generally recognized reality. And then just also to make sure that you're doing those behavioral observations and you try as many of those interventions as you can. And also be aware, and this might be something that go in the personal information form, you know, be aware of past traumas. You know, it might be important to note that someone was a veteran when you're taking care of them, or that someone is a survivor of some other disaster. And of course, naturally, it's important to remember, and again, for someone that maybe is not used to working with clients with dementia, that you never forcibly force the person. The next slide. Some additional strategies, and again, this is just a list of things, you know, but many times it can be simple. You know, it doesn't have to be complicated. That's the beauty of person-centered care, knowing what makes that person have the best day they can have. And so it may be just offering them one of their favorite foods or listening to music. I think we all know the power of music and how that can really be important. But look at some of those other evidence-based therapies. And again, if you go to our dementia care practice recommendations, those evidence-based theories are listed in our article around supporting activities for daily living. And now, even though the evidence base is small, we know that things like aromatherapy, validation, reminiscence, or pet therapy really can make the difference. And then just a few more. One of the things that we're really hearing a lot about is connecting with friends and families using applications like Skype and FaceTime. And so again, if you're in the client's home, helping them if they're living alone, maybe utilizing some technology for them to, you know, to call their children or call a friend, or just connecting them can really make a difference. The next slide. And then again, just using anything as relaxation techniques to help them, supporting their spiritual needs. Sometimes it is just talking to that particular staff person or a special person that has a connection with them. Or again, using technology. If someone is having a particularly bad day, connecting them through technology to someone that could really help calming them. And again, naturally just moving them and having a quiet area where they can have that consistent routine environment's always helpful. Next slide. And then finally, you know, if non-pharmacological treatments are not effective, then, you know, there is always a time where there may be an appropriate for a pharmacological treatment. You know, we know that in all healthcare settings, there's an overuse of antipsychotic medications to deal with dementia-related behaviors. And if you look at the nursing home field and the National Partnership to Improve Dementia Care and the work they've done in the nursing home settings, it's getting much better. And it's getting better because more practitioners now understand that non-pharmacological approaches are the best way, and to using these off-label medications is not the best approach. But if the cases that those are needed, it's important to remember that those are started with a start date and an end date, and they're always reassessed to make sure that they're not just left on those medications. Then the next slide. So just to wrap this up, we know that dealing and working with and providing the best possible care you can for folks living with dementia really boils down to providing a consistent routine as much as possible, and using person-centered care approaches as much as you can, and knowing that every interaction or task is an opportunity for engagement, and always putting the person before the task. And then the next slide. Just also want to let you guys know, we have a 24/7 helpline, and that is staffed by master level clinicians, 365 days, 24 hours a day, 7 days a week. And we really encourage you to call that number. You know, that number is for people living with dementia, their families, and caregivers. So if you have a question, if you are struggling with some information that you don't quite know how to deal with, give our helpline a call and we will be glad to help. So I will stop there.
Fantastic. Well, thank you so much, really, Doug, for that deep dive. And I think even some of the questions that are coming up or have come up in the last couple of minutes, some of that was answered in the presentation, and would love to kind of dig down and go deep with some of the questions that have been asked. So what I'm going to do, seeing how we have roughly about 15 to 17 minutes of question time, I'm just going to get right into it. And then what I want our panelists to do is, as succinctly as possible, answer questions so that we can get to as many questions as possible. So I'm going to start out with just some questions that came out from the health side. Dr. Reddy, what is the difference between sort of N95 and KN95 masks? Could you talk a little bit about the sort of mask differences and what does it mean to wear a mask? I think in these days too, there might be some confusion around that.
So the N95 specifically are a type of masks called respirators, and they're the PPE most often used to control exposures to infections transmitted through the airborne route. On the CDC site, which we'll provide a link to you, not just for the general CDC site, but for the specific links, such as for optimal use of PPE during surge capacity. The other types of 95 masks were not specifically made for infectious disease, but during surge capacities, it might be possible to use those. So the different scenarios that I mentioned before are listed on the CDC site. And right now, the N95s are so difficult to get that in certain cases, then the other type of 95 masks are okay to use. The other thing I will say, I saw another question about somebody had a lot of N95 masks, but nobody to fit them. And I will say that the proper fitting of an N95 mask is crucial for its benefit. So I don't know, but there's nothing on the CDC site specifically about what to do if you can't be fitted for an N95 mask, but I would think that that's really not even the same as wearing an N95 mask if you don't have the proper fitting. So yeah, I'll stop there for now.
Fantastic. Thank you so much for answering that live. And then Steve, we have quite a few questions for you just in terms of filing insurance claims. And Jill Bretson asked this question. So I'm going to read out the question and then we'll see if we can get Jill live to give any sort of nuance around it. So if a business income claim is denied and the government comes back and says there's coverage, will claims already turned in and denied move to the front of the line, or would they need to be resubmitted? So Jill Bretson, we're going to get you on live to see if we can, you can add anything else to that question that I may not have been conveyed. Do we have Jill on, or is she muted? All right, so it doesn't look like we have Jill on, but go ahead, Steve, and take a stab at that question.
Yeah, there's a lot there. There is a lot of pressure out there for business income claims under property to be paid, and certainly claims denials are coming out there. One of the important caveats here, of course, is that every carrier and every policy is different. Everybody's policy could be unique. And so if you've gotten a denial for a claim like that you've submitted, I think it's important to get documentation in terms of the claim number, any of that information. So should something change down the road, being that a governmental mandate for coverage, and some of those are being heard in different states, that you've got your information, because I don't know necessarily how every carrier is going to handle those situations. There's been some discussion that maybe this could be handled on a similar basis as what's been done with terrorism insurance, that would be handled through a global program, and there's getting some leverage for that. So at this point in time, it's very early to tell what's going to happen, but I think any documentation you receive from your carrier on a denied claim, you need to hold on to. And should something change, revisit that with your carrier to find out exactly how they're going to handle that, if at all. That might be handled by another entity. We just don't know at this point.
Yeah, Jill, I know you're on now. Do you want to add any nuance? Or did that answer your question? Oh, well, maybe she's not on. So in either case, thank you so much for answering that. And we've got a couple other questions. So thank you, Jill, for your question. Another question for you, Steve. You know, this is a time of kind of doing what folks need to do in order to kind of get through moments. And so we've gotten a lot of questions over the last couple of weeks about mitigation of risk. So here's another question that came from an earlier roundtable. We're an in-home care agency who provides assistance to seniors in their homes. We're relying on our employees to self-monitor and report symptoms, as they do not report to a single location before reporting to clients' homes. My biggest concern and fear is that employees will not be honest because if they don't work, they don't get paid. What advice would you have to help us mitigate risk at this time?
You know, mitigating risk in this challenging time is something that everybody has to take a close look at. And I think what's important with respect to liability, again, every policy could be different, and your action or lack of action could potentially cause liability. But what's important, I think, is proper documentation of processes and procedures, and make sure that those things are being shared with your staff so that they understand what they're supposed to be doing in accordance with what your organization is now doing, given our new challenges, and also making sure that they're keeping up with what's going on in the nation and the state and any new mandates coming out there. And we referenced CDC as a great source for that, but making really good, careful decisions with those policies and procedures and documentation is really important right now.
Absolutely. Thank you so much. Documentation. I think that applies across the board. And so another just sort of general question, this comes from Howard Snow. As this pandemic continues without a vaccine, do you feel that families will begin pulling their loved ones out of a facility and move them back into a private home? I think you all have different advantages of the long-term care landscape. Do you all have predictions, or what are your general thoughts around this?
So maybe I'll go first. Yeah, again, that's a great question. You know, I think that it has happened already, that some people have taken their loved ones out of long-term care facility, and, you know, there's no predicting the future, but that is just generally not possible for a lot of people because they're working or their loved one requires a lot of care. So, you know, if I don't know what's going to happen with respect to that, but I just don't think that, in my opinion, I don't think it's realistic that a lot of people will be able to go back to a home, to their own home.
Mm-hmm.
Yeah. This is Doug. I agree. I would just add on to that. You know, most people that are in assisted living and nursing homes are there because they were in a situation where they could no longer live safely at home or have someone that was be able to take care of their needs. We know the average age, you know, in nursing homes and assisted living, I don't remember the latest statistics, but it's 82 plus. You know, there is no standard answer, but, you know, there might be rare circumstances. For instance, I have communicated with one gentleman whose mom was in a Medicare skilled unit community for a knee replacement. And so, you know, she was pretty high functioning. And so she was, you know, he was able to take her home. He hired in-home care to come in and sort of help her with that rehabilitation. But I think that's the exception, not the norm. Most of the people that are in assisted living or nursing homes are high care. Most of them have several comorbidities. Many of them are incontinent. Many of them have complex medical needs that they need that 24-hour supervision of nurses to be able to provide their care. So while I know it's scary to know what's going on in a lot of these communities, I do think that they are all trying their best right now to provide the best care they can. And in many instances, families just would not be able to provide the clinical care that's needed if they're brought home.
Absolutely. Any other comments on that? I completely agree, and I think you know, both of your responses were great in terms of my own thoughts. Let's keep it moving. So Tina Burks asked, we've seen some of our memory care patients have had some noticeable issues, additional confusion due to routines being so disrupted because of COVID-19. Activities they used to do in our communal areas are no longer possible and things like that. What kind of language or things that should we do to make them understand without making them fearful? I think that is a really great question that summarizes some of the feedback. How do, Doug, what would you recommend, and Gary, please feel free to chime in, would you recommend, just in terms of the general level of confusion that may already exist, especially with breaking up routines? Any recommendations?
Well, I think, and we know it's hard to do, but as we've said, as much as possible, having as much of a consistent routine, even if this time of crisis, that you can with folks is important. I think it's important to people to understand, and that's why we suggest this personal information form. Again, going back to person-centered care, every person is unique and every person with dementia is unique. And there may be certain things that work for one person that may not work as well for another one. But naturally, I think looking at some of the things that we list in these guidelines is sort of ideas, and then taking those ideas and applying them individually with each person to see how those might work is really the best avenue you can approach.
Mm-hmm. Great.
I would add that it depends. I totally agree with Doug. And I'd also add that how much information you tell them or how you convey the information is also dependent on their level of cognitive impairment. So if they're able to understand things like the pandemic, et cetera, you might want to tell them a little bit more. Whereas in some cases, if they're aware enough to know that visitors have been limited, but they're too confused to understand something more complex, you might want to say something like, we're limiting visitors now, but it's going to be okay, and just be more reassuring than anything else.
Yeah, so thank you so much. And then we'll answer a couple more questions before we wrap up for today with some takeaways. So Deborah Weaver asked, what are the trends for companies paying sick time for COVID employees working at the time of their infection, and what practices can be utilized? Can you all speak to that? Steve, do you have any insights around that?
I don't have a whole lot on that. I know that there are legal entities out there who have been conducting webinars specifically related to the sick time and recent legislation and acts that have been passed. And I know it gets very confusing because you've got national acts out there and states have enacted acts themselves. And you're as a business owner, you're stuck there kind of wondering, well, what do I do? How do I cover this? And what circumstances would this be covered? And so really in those situations, I really encourage you to reach back out to your states for some interpretation on that, and hopefully seeking out some legal expertise on when you are able to file those claims.
Perfect, thanks so much. And then just around infection control and sort of the infection timeline of COVID-19. I think, this is something that Madhuri, would love your help in responding to with Maria Bruning, who asked, what is the guideline for a caregiver to return to work after testing positive for COVID-19 and being out for 14 days, but still having respiratory symptoms?
Yeah, very good question. And again, the CDC has specific guidelines for when healthcare personnel, and I believe the home care workers are likely included in that healthcare personnel definition. And they do give a definition on the site. And I would say that home health personnel are included. So the CDC has very specific criteria of when people can return to work. And there's basically two methods. One is a test-based strategy where the caregiver has had a test to say if they're positive or negative, and the other is a non-test-based strategy where they go back to work depending on their symptoms. So I'll just provide the link for that rather than go through the details, but I will say a lot of people, of course, have no symptoms as well, so just symptoms alone without anything else may not be the best, but I'll send you that link, or we'll share that link with you.
Perfect. Yeah, so we will share all links. Given that we're, we know that you all are busy, and we'll definitely make sure that we provide any links to our presentation as well as this webinar. If we didn't answer your question, or we didn't have sort of some of the expertise to answer a question on any given week, we usually roll that question over, and we'll just keep answering as many as possible. Would love to get you all's takeaways. Let's go ahead and get into our takeaways for this week. Madhuri, what are your quick takeaways?
So I'm just going to direct you again to these specific links. One is the CDC recommendations for PPE in various situations, including shortages. I will say I've had a few questions about handmade masks, and I want to reiterate that handmade masks do not protect the wearer. They're intended to prevent the spread to other people. Second, CDC also has guidelines of how you may want to allocate staffing. And I've also included the return to work restrictions, and finally, precautions in the home for home health, home care workers.
Fantastic. Thank you so much, Madhuri. And then also, Doug, your takeaways, please.
Sure, thank you. And just thanks for being on the call today, and thanks for all you do. I mean, you truly are our heroes right now. So thank you for the work you're continuing to do. And again, my takeaways are just remember when you are working with your clients to use those person-centered care practices, make sure that every interaction is an opportunity for engagement, and put the person before the task.
Thank you so much, Doug. And last but not least, Steve, your takeaways?
Yeah, and I'll echo Doug's comments too. Just a sincere thank you to all of those working on the front lines, taking care of all those that need that care and attention. Hopefully, you know that you've got the country in your thoughts and prayers. But yeah, the three takeaways I have, first off, in these challenging times, it's important to know that if you do have coverage about potential claims or liability, reach out to your agents or your broker with those questions so they can research those things for you, because policies vary by coverage terms and conditions, and so each one could be different. So definitely reach out with those questions and get a direct answer. The next one I have is that entities are introduced to all these new concerns, forcing everybody to reevaluate their processes and procedures, thinking about things that we've never had to before, but don't lose sight on some of the existing exposures that are out there. And a great one that I give an example of here is the cyber exposures. Unfortunately, there are bad people out there, and they're still out there. And so in this age where we're spending more and more time with social distancing and more reliance on technology, be aware of protecting the privacy information and be aware of some of those bad guys out there, and the cyber criminal actions and activities are certainly ramping up as well, unfortunately. And then the last one is just, while we talked about it before, communication's key, documentation's key. Any new processes and changes, make sure you're communicating those things and documenting those throughout the organization.
Fantastic. So just even, I'm going to do a quick sweep of some of the questions that are showing up in sort of reaction. So the slides will be made available. Anything that was in today's presentation will be made available on our website. Alongside that, we also have our free certification that is available to direct care workers, specifically on COVID. And what I should add, and I think it's been tremendous, and hats off to our content team as well as Dr. Reddy. It is updated on a very frequent basis and also includes just more education around PPE and some of the more updated guidelines from the CDC as well. bit.ly/COVID-19 certification. And that's available on our website as well at www.careacademy.com. So our class has been updated again as of April 9th, and it will be regularly updated. Our class is now available for free on our website. So if you're a customer of CareAcademy, we're waiving our fees for additional users for that class up until April 30th. If you have any questions about that, feel free to call us. And again, if you're just tuning in, this webinar as well as the slides will be made available on our website for download as well. So with that being said, I want to say thank you all. You all who are tuning in, your direct care workers are the heroes. I'll echo everything that our panelists said. I really appreciate you all. We appreciate you all tuning in. We'll try to answer more of your questions next week. So if you didn't get your question answered, we'll make sure we kind of roll that into next week. These are happening until you guys get tired of us, but hopefully we provide just some insight into what's going on and any guidance as well. So with that said, I want to thank all of our panelists, Doug, Steve, Madhuri. Thank you so much for your insights this week. It's been tremendous. And we definitely appreciate your information and insights. And We'll make sure that your contact info and any of the helpful links that you provided will be made available to folks who attended and did not get to attend today. So thank you so much, everyone.
Thank you. Thank you, Steve.
All right,
Thank you, Doug.
Thank you.
Thanks,
Thank you
Helen.
so much, everyone. Have
Thanks,
a great
everybody.
day.